Hey everybody, I hope you had a wonderful Thanksgiving. This is Dr. Aaberg from the Park West Dental at Channing Way. I'm taking my day off to use this as an opportunity to talk about something I really love discussing with patients, and it comes up often. So we're going to talk about how to replace a single missing tooth. Now, this is assuming that you have been missing the tooth for a while, because if you need a tooth that's extracted, there might be some extra steps or some considerations. So we're just going to talk about your teenagers who might have been born without an adult tooth in the front, or you broke a tooth a long time ago that you had to get extracted, but now you're ready to replace. That's what we're going to be talking about. And typically there's three different options, and we'll dive right into that with some graphics and designs and everything. But before we begin, I want to just kind of remind you that we actually have a wonderful promotion. So let me show that to you here. We have our Facebook page at Park West Dental Channing. Oh, it's supposed to be able to screen share, but it's not letting me. Sorry about that, guys. So what we do is we have our Facebook pages at Park West Dental, our Channing location, and our Park West Dental. That's our Pancari location. What you can do is you can win a Roku TV that's 40 inches. And we're going the way that you do that is you enter you like those Facebook pages. So you go to the Park West Dental Channing Facebook page and like it, and you can go to our other office, the Park West Dental page, and like that. By liking that, that's an entry. If you want other entries too, if you tag 2 friends, you can get 2 additional entries. We'll be announcing the winners on January 3rd, so we're at the final stages, the final month of entry. So go ahead and go like those pages, and then you get to learn some more cool things with Dr. J and Dr. I. We like to do this about once a month and get to see some cool posts about what we do at the office. So go ahead and go over there to like that. Now, replacing teeth. So say you're missing a tooth in the front like that, and this is a very common situation for teenagers because this is a very common missing tooth. They just don't grow that tooth, and we have to wait for the teenagers to finish developing skeletally before we can replace that, right? So there's some considerations for that. Or say you broke a tooth long ago in the back tooth, and so you're missing that space there. So we need some ways to be able to restore that. And we mentioned there's 3 ways. The first way is called a flipper denture or a partial denture. The reason why it's called a flipper denture is because you can put it in and out of your mouth. It's removable, and so you can flip it in or flip it out, hence the name flipper. And the way it works is we have this pink acrylic right here, and it's custom fit to the roof of your mouth. Sometimes we can even put a little bit of clasps on the side so they anchor to the back teeth, and then you just have this acrylic tooth in the front. So what are the benefits of this flipper? Well, let's say you're that teenager that's still needing to grow, and so we can't put a permanent fixture in there yet until you've fully developed. So this is a good temporary option. They're quick and affordable, so if you're not quite ready to invest in a bridge or an implant, then you can use this as a temporary option as you save up and kind of figure out dental insurance or anything like that. And then, again, just really, really affordable, but it comes with a cost, of course. These are pretty non-functional because they're not well anchored to the other teeth. They just kind of sit there on the roof of your mouth or on the bottom of your mouth. They don't really have that biting and chewing ability, and they're made of acrylic teeth, which is not as sharp or tough as your porcelain or your natural teeth, so they're less functional. So they're kind of inconvenient because then you have to take out your tooth in order to eat. So some people don't like that. There's less color choices for this tooth because it is acrylic, so there's select colors. You can't get that custom shade that you can for your permanent teeth. And then you have that acrylic on the roof of this mouth right here. It's going to be sitting on the roof of your mouth. And some people, if they have gag reflexes, are uncomfortable with that. Some people report having that alter the taste of the food if you're trying to eat with it, or you have something on the roof of your mouth. So there are some drawbacks, but quick and easy. You can have this made in 2 or 3 weeks after just a single impression. So a really easy way of fixing that. But let's say you're ready for the permanent fix, and you don't want to have something that's removable. You can't pop it in or out. You just don't want to deal with that anymore. Or that teenager is finally developed and not growing significantly skeletally wise, we're ready for that permanent fix. So another option, the first option that we do for permanent is called a bridge. So what is a bridge? Basically, you're going to have two teeth that are next to the missing tooth in the middle. And what we do is we have you come in for an appointment, we numb you up, and we shape this tooth here and this tooth here so that a permanent crown that's 3 units long can be made and cemented on this process. So these are made of a ceramic porcelain, so they're very strong, very beautiful, and they'll go all together as one piece. And so these two teeth next door to the space will hold the fake tooth in the middle. And that's why we call it a bridge. Think of a river, you have two sides, and the bridge in the middle, that's what this bridge is right here. Now, there's some indications when we choose when to do a bridge, because of course there's the option of an implant, which we'll get back to later. And the indications are really ideal for when this tooth that was next to the space was already beaten up anyway. And so you needed to have to crown it or cap it anyway in order to fix it. So now you're killing two birds with one stone. You're fixing the tooth next door while getting that tooth replaced in the middle. And then the other time that we typically choose bridges is if you're a patient that's not a good implant candidate. There's a lot more things to consider for implants, such as bone quality and availability, which we'll get back to. So this is a very good option if you're not a good implant candidate or if you have teeth next door that need crowns anyway. So the benefits, the pros is it's permanent, unlike the flipper denture, so you don't have to worry about it popping in and out. We get it completed in 2 to 3 weeks as well. You come in for one appointment, we get these teeth shaped, we give you a temporary bridge so you still have something to bite and chew and smile with, while a lab makes this bridge in 2 to 3 weeks. And that lab, we have a great lab technician in our office. He gets a perfect shade match, so you don't have to worry about the acrylic not matching the color of your other teeth right there. You get a perfect shade match, and it's functional because this is a hard ceramic, a nice porcelain here that's really able to bite and chew, unlike that partial denture. Now, why would we not want to choose a bridge and maybe choose an implant instead? The trouble with bridges is it ties all 3 of these together. So this tooth here and this tooth here are all tied together, which makes it difficult to floss. You can't floss these together because they're all stuck together. So you can't feed floss through there. And what does that mean? It makes it really easy to get a cavity here or here right underneath the bridge. And so you're going to have to feed some floss through underneath that fake tooth and clean it out really good. Otherwise, you can get a cavity on this tooth or the tooth next door. And if you get a cavity on this tooth, because they're all tied together, if one tooth fails, all 3 fail. So if you have a problem with one tooth, then we're going to have to replace the whole thing, and that can get expensive. So you have to be really diligent about keeping these clean. It is possible with good oral hygiene and coming in for your cleanings, these can last for 20 years, but it is a drawback. And another drawback is if this tooth was perfectly healthy and it didn't need a crown or it didn't need a cap, then you've cut away perfectly good tooth structure and tied it to other issues, tied it to the other one there, and you're just setting yourself up to a difficult maintenance there. And then if you're missing a tooth in the very far back of the mouth, you need to have 2 teeth next to that space. So if you're missing your very far back tooth, there's no way to be able to bridge it. And so that's one of the drawbacks, is you can't replace every single tooth, but most teeth you can. So finally, the third option is an implant. So what's different about an implant is instead of working on the tooth next door to the space, we just get to focus only on the space. And the way we do that is you come in and you have what's called an implant. It looks like a screw in your x-rays, and you literally screw it into the bone there, okay? And when you screw it into the bone has to heal, and bone is bone. Like a broken bone takes forever to finally heal and remodel. So it can take about 4 to 6 months before this implant is ready to receive the crown. So in that 4 to 6 months, we might have to have a temporary solution like your flipper denture again, where you still are able to smile with something while this implant is healing. But once this implant is finally healed, then you get to come back, we take an impression, and we have that same lab make a beautiful porcelain crown that'll screw into the implant that's within the bone. So there's a couple parts to an implant, the major point being what's in the bone and part of the tooth right there. Now, what makes a good implant candidate? You need to have enough bone. So if you're screwing an implant into the bone, you need to have enough width and height in order to get some stability. Think of screwing into a drywall versus a stud. If you're screwing in a drywall, things are going to be able to fail and fall out because you're putting too much pressure onto that. But if you had a nice, healthy, wide stud that you can screw into, you're able to put more force on it. So you have to have enough bone quality and quantity in order to place an implant. Now, sometimes we can work with grafting and even specialists to rebuild the bone, but that would be some extra steps to consider for implants. And then you need healthy gums. So implants can't get cavities. That's one really cool thing about it. The tooth itself can't get cavities. But what can make an implant fail is gum infection. So if you're starting with gum infection and you place an implant there, you're only putting yourself up at risk of having an implant fail because of gum infection. So we have to treat gum infection first before we're able to place an implant. Now, what are the pros of an implant versus a bridge? So it's its own tooth. It's not tied to the two teeth next door. So if maybe you accidentally broke the tooth next door, well, you just fix that tooth. You don't have to worry about the implant or the tooth two teeth over. So because it's its own tooth, you're not tying everything together. It also can have a perfect shade match because our lab makes this beautiful porcelain crown. It's flossable, so you're actually able to clean it because since they're not tied, you're able to squeeze some floss in between it like you were flossing any other teeth. It's as if you were born with this implant. And it can't get cavities, but remember, it can still fail from gum infection, so you do have to keep it clean. It's not like a tooth where you'd never have to brush it because you can't get cavities. No, you still have to keep this implant clean. And then the cons. So unlike your bridge, which can be done in 2 to 3 weeks, this is a much longer process. If you are missing the tooth already, we can go straight into having the implant placed and wait 4 to 6 months and then have a crown made in 2 to 3 weeks. If you need extractions, that can almost double the amount of time it would take to fill this gap. But remember, we still have some options to fill that space while you're healing. So it's not the end of the world and such a good outcome if you're a good implant candidate. You have to be careful about gum infection. You cannot be coming in with gum infection in order to start this process because it does increase your chance to fail. And one thing that increases your chances of gum infection is smoking. So if you're a smoker, we'll have a good conversation about what kind of risks you have of this implant not lasting long or not integrating in with the bone. So if you're a smoker, we just discuss those risks for you. And then it may require some bone grafting, some reconstruction. So there's a little bit more considerations to make sure that you are an implant candidate. Now, we talked a lot about replacing a front tooth. A lot of my diagrams showed a front tooth. And of course, that's important because it's our smile, it's our aesthetics, it's our confidence. But sometimes I have a lot of patients who come in and they're missing a tooth in the back and they're not worried about it because I can still chew and eat and it's not part of my smile. I just want to let you guys know, though, there is a consideration. If you're missing that tooth for a good long time, teeth will move. Teeth like to drift. Teeth like to touch other teeth. And so what can happen is you start off with a nice smile where your molars are locked up and your canines are here. We're basically looking at the side of the teeth. And you're missing this tooth here. Over time, the arches will collapse. That's what we call an arch collapse. And it's because teeth will move because they want to touch something. So this tooth was used to touching a tooth in the front. It's actually going to tilt into that space. And because it tilts into that space, you get a gap here and here that's much harder to keep clean. And then the tooth on the top will actually literally grow into that space right there. See how that space is much smaller? So because it's growing out, it's much harder to put a fake tooth there, whether it's a bridge or an implant. And because it's growing out, we'll get a little bit closer there, you'll actually have exposed roots. And so those exposed roots can cause sensitivity. Roots don't insulate from your temperature and can really feel cold a lot easier than your normal tooth structure. And because it is roots right there, They get cavities much easier, and you can just see how big of a space there is for food to get stuck, so they're much harder to keep clean. So not only you're making it difficult to fill the space back up because you can't really put in a tooth, there's nothing there, now you're increasing your chances of cavities all around it. So when you have a tooth extracted and you're not ready to restore it, you should consider trying to get in sooner than later, because it makes it more difficult and easier to have problems in the long run, and more difficult to fix those problems and more expensive. So the sooner you're able to do that, the better. And the sooner you're able to do the replacement after you lose a tooth, the more likelihood you are to be a good implant candidate. So some considerations. Now, that's all I have to give about how to replace a single tooth. Of course, if you have a tooth that's bothering you that you think needs to be extracted, don't be afraid to call an appointment. We can talk about some other considerations, but we really like to focus our care and give you the ultimate treatment that's specific to your needs, basically what's best for you. So with that, are there any questions? Okay. And that's okay. I'd like to answer questions in person anyway, so don't be afraid to come in for an appointment for an exam. And speaking of appointments and exams, this is the end of November, beginning of December, so for a lot of patients, this is their last month before their insurance expires. So I definitely encourage you to come in for at least get your cleaning and an exam before your insurance expires and resets, get as much benefits as possible. The sooner you're able to come in, we might be able to even be able to do the bridge before your benefits expire. Just want to be able to use what you're paying for. But otherwise, we'll see you in January. Hopefully you're one of the winners for that Roku TV, and hope you have a wonderful Christmas. Take care. Goodbye.